safety signals of specific interest for T-DXd, in particular ILD. What did that data look like in Destiny Breast 11 in the experimental and the control arms? And in particular, were there any grade 5 events in each arm?
Yeah, important question. Certainly in the curative setting, we're watching this very closely. And I was very reassured to see that the overall rate of ILD certainly was not higher than what we see in the metastatic setting. In fact, it was a little lower. And in terms, to address your question with regard to grade 5 events or death related to ILD, there was one death related to ILD in the T-DXd arm, and there was also one death in the control arm as well.
I see, so kind of offsetting in that regard, not an imbalance at least.
Right.
Interesting. Now, another adverse event of special interest is cardiac adverse events, and there were more in the anthracycline arm.
Yes, yeah, I mean, I would say anticipated, but yes, there were more cardiac events in the anthracycline arm, getting back to that point of why, now that we have this data, and pending approval, of course, why leave patients at that long-term risk of anthracycline-related cardiotoxicity when we don't see that with T-DXd?